Welcome back to Health Talk. I'm your host, Pat Pingatore.
And I'm Sal Shalero. Today we're talking about minimally invasive surgery with Dr. Michael Silberstein from Sound Shore Medical Center. At the break, we were talking about your friend, the Da Vinci robot. I don't know, do you call him Dave? You call him Vinci?
No, Leonardo.
Yeah, Leonardo.
Leonardo is his name.
There must be, I'm just assuming, there must have been extensive training before one could get to use this thing.
Exactly. So the typical pathway for training for general surgeons is come out of medical school, you do a 1-year internship followed by 4 specific years in general surgery. So 5 years in total of specific training after medical school. In the past, that would be what most surgeons would get to become a general surgeon in the community. As things have become more specialized, there have been newer fellowships to add on after that 5 years. I did an additional 1-year training in minimally invasive surgery, bariatrics, and robotics. These are fellowships that really started in the late 90s, and there were only a couple of them then. Now there's, I don't know, at least 100 around the country.
Where was the training?
I did my training at Hackensack University Medical Center, which was a wonderful place. It's one of the busiest hospitals I've ever been at.
One of the biggest, too.
And absolutely one of the biggest. And it had some really wonderful minimally invasive surgeons that I got to train with. Additionally, it's the Northeast Training Center for Da Vinci. So there was a specific training lab for the robot there. They had, I believe, 6 robots at Hackensack, 3 in clinical practice, and 3 in the training center. And in order to be certified on the robot, you have to do a special 1-day course on the robot, as well as use it while being proctored. So I went through all of that to be able to say that I'm a minimally invasive surgeon with robotic.
The course.
Exactly.
Got a good grade?
Yes, I did.
So you also said you're involved in the field of bariatrics. Explain to us what bariatrics is, and then also talk a little bit about how minimally invasive surgery impacts the field of bariatrics.
Yes, I do bariatrics, and I really love the field. Bariatrics, simply put, is the surgical management of weight loss as it pertains to bariatric surgery specifically. Diet and exercise are still a wonderful tool, and most people within the population will, from time to time, put on 5 or 10 pounds around the holiday and take off 5 or 10 pounds throughout the year with something as simple as diet and exercise. Certain people, for whatever reason, whether it's genetics or psychosocial, socioeconomic reasons, reach the level of morbid obesity. And it's a very specific definition. For people who reach that level, diet and exercise alone will only succeed in about 2% of those people. So
wow, that's low.
Bariatric surgery is around for that reason. The success that we have is pretty universal and can be pretty profound. These people who reach morbid obesity have significant problems with high blood pressure, with diabetes, with sleep apnea. They can cause terrible problems with your joints. These patients come to us on 10 different medications, really suffering, spending a lot of time at their physicians. After the surgery, if they have success and they lose 50 pounds, 100 pounds, 200 pounds more, they stop having diabetes. Their blood pressure is normal. They get off all of their medicines. They're able to walk. They're able to exercise.
The side effects are pretty
it's fantastic. It really is. And
Sound Shore has been one of the pioneers in bariatric surgery. Is that correct?
Absolutely. Dr. Rangraj has been doing this for quite some time. He set up a bariatric program at Sound Shore.
Is he still there?
He's still there. He's the boss. Coming up on, I think, 9 years ago. And they've done hundreds of cases in that period of time. We're still seeing patients come in just the other day, 250 pounds in 4 or 5 years. And really
lost that much?
Lost that much.
That's amazing. Now, you said morbid obese patients. That's 100 pounds or more overweight?
That's one definition of morbid obesity.
I think that's a minimal requirement. In order to qualify for bariatric surgery, you need to be like 100 pounds overweight.
Exactly. That is one of the definitions. We use something called the body mass index.
Right.
Okay.
It has to do with your height and your weight and some combination thereof. Obviously, the amount over your normal body weight is different for someone who is 4'5" and someone who's 8 feet tall.
That's true.
So once they reach a body mass index of greater than 40, they're considered morbidly obese. We consider them also morbidly obese if they're over 35 and they have certain comorbid conditions.
Just curiously, more men, more women, bariatric customers?
In the population that we see, the typical patient is about a 45-year-old woman. We have more women than men.
I do.
Okay, and I understand that there's a new unit at the hospital for people who are recovering from surgery, and I know we're going to be showing that on the screen in just a few minutes.
Absolutely. Well, as I said, Dr. Rangraj made this bariatric program almost 9 years ago, and it's become what was referred to as a center of excellence. The society that sort of oversees bariatrics goes to the hospitals and has certain requirements to be a center of excellence. You wouldn't think about all these things, but not only do we have 3 specific bariatric surgeons, we have a bariatric coordinator, we have bariatric nurses, we have our very own bariatric suite, which is beautiful. We have bariatric specific anesthesiologists. But for instance, what makes a center of excellence different?
We're going into the bariatric suite.
And what is that, a recovery area?
This is the entrance hall to the bariatric suite. And what you'll notice if you look carefully is that the doors are wider than typical doors. We have beds and stretchers that are wider and have higher weight requirements than typical.
Chairs, everything, yeah.
Absolutely. Something as simple as the bathroom has to be certified to be a bariatric center of excellence. Most toilets come off of the wall and only able to hold a certain amount of weight. We have bathrooms that have floor-mounted toilets.
Take us through this. I guess that was obviously a reception day. And this is
one of the patient rooms. You'll see we have full Wi-Fi. It's really a wonderful. They're all individual rooms.
Single private rooms.
And you can see the equipment, how it is really larger to be more comfortable for those recovering patients.
That's not just a visual cue. That chair really is twice as wide and to accommodate our bariatric patients.
And what's a typical recovery period? How long are they in the hospital?
So we do 3 different operations at SoundSure. We do the gastric bypass, the gastric band, and the gastric sleeve. For patients who have the gastric band, they're in and out often the same day or overnight.
I see this is an area on the unit that they use for physical therapy so that the patients don't have to go down to the physical therapy department?
Absolutely true. Everything is self-sustaining within that unit, and it really is a beautiful unit, and it's great for the patients. They have everything specifically built so that they have the quickest, best recovery from the surgery.
Okay. And well, there's a recovering patient, and I see the good doctor there.
That's a room. How many rooms, and how long do they stay in one of these rooms?
There's about 20 rooms. As I said, for the band, they often stay just overnight, if at all. For bypasses and sleeves, they're usually in the hospital between 2 and 3 days.
Can you show us the difference between those surgeries? I know you brought something with you.
So this is just a gastric band model. So this is the stomach here.
Why don't you bring it over here?
This is a model of the stomach here, and the way the band works is it comes around the upper portion of the stomach, sort of dividing off this new small stomach pouch from the larger stomach. So when patients eat, this small area fills up with food. There are some stretch receptors within this area, and patients have a sense of early satiety. It decreases the amount of food that they eat and leads to weight loss.
This is the band version.
This is the band version.
That's pretty popular, the band version, right?
Well, they're all pretty popular, and probably we do about 1/3 of the 3 different types of surgery that we do each.
As effective? Is this as effective?
Different levels of effectiveness and different levels of risk. This is the quickest surgery. Patients are in and out of the hospital often the same day. The recovery time is a little bit shorter, but the weight loss isn't as significant.
Gotcha.
We tailor it to the patients themselves. Patients who are larger and who have more significant comorbid conditions will oftentimes need a bypass. And patients who don't need as much weight loss, often we will suggest the band as opposed to the bypass. It really depends upon a number of factors, and we have one-on-one discussions with all those patients to really decide what the best operation is for them.
And I know you have a wonderful team. The bariatric team is a great team.
They're fantastic. I mean, I love coming to work every day. I love the people that I work with, from our program facilitator, Judy, to our program coordinator, Roberta, Peggy, who's down on the floor, who used to be our coordinator, now runs the entire bariatric floor. All the surgeons. We have 2 dietitians. We have a bariatric psychiatrist, anesthesiologist. We all work together.
And
it's
really
really
amazing.
Lot
of rooms too in that suite.
It's a big program.
You must do quite a few bariatric surgeries.
We do. In order to be a center of excellence, you need to maintain at least 125 cases a year, and that's the level that we've been maintaining.
Couple of weeks. Yeah.
Wow. Tell me what it's like to see someone after they've had the surgery. Like you said, you saw someone a few years later. How has their life changed?
It's really amazing. Oftentimes these patients, they lose their diabetes the moment they wake up from the surgery, which is something that we don't fully understand, but it is absolutely real and it is absolutely life-changing. Having gone through all different types of general surgery, patients are frustrated. They have sicknesses and you help them as much as you can. With bariatrics, the patients really, it changes their lives. So patients that I've operated on 6 months ago were coming back and they've already lost 100 pounds. We have pictures of them which we follow and we track their weight. And when they come in 100 pounds lighter, off of all of their medicines, fitting into clothes they have up in their attic they've kept there for years. Honestly, it's one of the greatest feelings. They come in smiling and happy.
I remember attending a function at the hospital about 3 or 4 years ago. It was a reunion, to answer your question, a reunion of these patients. And very much like a class reunion, they wore a badge with the picture of what they used to look like, and you wouldn't recognize the person. After a person loses 100 pounds or more, that's a significant loss of weight. Sometimes it's half their body weight.
Yeah,
it's true. I tell all the patients to maintain their relationships pretty well, because if you go a couple months without seeing a friend, they may not recognize you down the street. It really is that significant sometimes.
But it's true. It's a life-saving thing. There were people who I heard them say couldn't get off the couch, and now they're riding bicycles and playing tennis, and they have boyfriends and girlfriends. Gave them a life. It's a life-saving. It's incredible.
Patients who've had a gastric bypass are 5 or 6 times more likely to be alive 5 years after the operation.
And as you mentioned before, the diabetes and all the other stuff, side effects.
A whole new world.
It's incredible.
We have only a few seconds left, but I think that it's worth mentioning the relationship you have with these patients. It just doesn't stop after surgery.
It's a lifelong relationship. They have to come back to see us so we can follow up. Some of them, we follow their vitamin levels. We make sure they're doing well. We track their weight. We make sure that they're eating the right foods and exercising. And if they're not, we kind of keep them back on the right track. It's a great relationship, and it's something we really covet. It's wonderful. It really is.
And they come back from the support group?
They come back for support groups. We have a support group once a month. We have a free seminar to describe the procedure to potential patients. We do that once a month, every third Thursday of the month. It's great.
It might be interesting to have Dr. Silberstein return at a future date with one of these patients.
Yes. I would love to. I would love to
do a before and after thing. It'd be interesting to hear from the patient, and you can bring Leonardo with you.
Yes,
we'll
roll him on out.
Unfortunately for us,
running out of time.
Run out of time, and unfortunately for our audience, because this was a fascinating segment. Thank you very much for being with us.
Thank you guys for having me.
For more information about minimally invasive surgery, talk with your healthcare provider.
If you have either a question that you would like answered during a future health talk or a topic suggestion, please email us at healthtalk@sshsw.org. Join us next week and every week at this time when Sound Shore Medical Center presents health information for your good health.